All set. So hello and good morning, everybody. Happy Saturday. Thank you all so much for taking some time today to sit in on this session. My name is Molly Ratliff, and I'm the Northeast Education Outreach Specialist for Naked Prosthetics, based out of Baltimore. A large part of my role consists of raising awareness and educating on the partial hand population, along with creating collaborative relationships between these multidisciplinary teams that care for this patient base. So I'm really excited to present to you all today about not only the devices, but also best business practices to take your clinic to the next level and become the partial finger and hand experts in your area. So whether or not you're brand new to NP and working with this type of patient, or you fit multiple devices already, I hope through this webinar you'll learn something new and feel prepped and ready to go out into your markets and grab your piece of that upper limb business. Feel free, of course, to use the chat feature should you have any immediate questions during the webinar portion. And while I'll try to answer them via chat in real time, rest assured I'll be definitely be sure to get them afterwards. So diving into some company background, if you're not familiar, NP is headquartered in Olympia, Washington, and everything that you'll see here is going to be a culmination of about a decade's worth of research and development. I'm proud to say at this time, we're in our second generation of NP's flagship devices, and we're always coming out with new innovations based on the population's changing needs. So to give a quick layout of the webinar, I'm going to touch on the patient population as a whole, break down each device, and cover the pre-evaluation and intake stage of the device acquisition process, and of course conclude with ways NP is here to support you through clinical assistance, education, and collaborative marketing initiatives to potential referral sources. So before we take a closer look at the features and functions of the devices, I want to first explain the patient population that we're trying to help and hopefully change the way that you might see this type of patient. There's this incorrect cliche stating that the upper limb space is a niche market, and even more so when referring to the partial finger and hand space. And this couldn't be further from the truth. Currently, there's about 1.6 million people out there living with limb loss. And literature shows that the cause of limb loss is almost an even split between dysvascular cases and traumatic events. Of those trauma cases, 2/3 are going to occur just at the digit level. In fact, it's going to be the most common traumatic amputation across the board and claims about 92% of the upper extremity amputee population, 94% if you want to add metacarpal to that. So this accounts for over 52,000 new amputations occurring annually in the US. So to put that into another perspective, for every one transradial or more proximal arm amputee that you may have seen or worked with in the past, there's going to be well over 30 digits out there potentially needing prosthetic intervention. And it's not often that this type of patient gets referred to therapy, and even less into prosthetic care. So there's this outdated misconception that this is a small population with a low level of need, when in fact it's very, very large and it just hasn't been seen. So to break that down a little more, the population that is going to be most the population that's going to be most affected by digit loss is going to be your otherwise healthy working age man. We see a lot of manual laborers and blue collar workers who go through this debilitating instantaneous trauma. And unfortunately, it's shown here that about 75% of those people cannot return to the work that they've been trained on and use to support themselves and their loved ones. And of that, 26% leave the workforce entirely. We'll go over a few examples of these later, but this type of amputation is often overlooked due to it anatomically being very small, but the long-term impacts for this population can be physically and psychologically severe. In fact, literature does show that it can be more severe than a more proximal upper extremity amputation because while the level of impact and disability is essentially congruent, the more proximal patients, unsurprisingly, receive more medical attention, resources, and support. So a great way to further grasp the severity of impairments of this patient population is going to be by looking at the AMA guides. So what these are, it's a nationally recognized tool that objectively quantifies permanent impairment, and it's a really effective way to combat the belittling language around partial hand loss. These patients, both in their personal circle and in their medical professional circle as well, often get talked at in this belittling way of, oh, it's just a fingertip. Aren't you glad it wasn't your whole hand or your leg? Or it's just a fingertip. It's not a big deal. You'll get over it. Um, Taking into account that the hand itself accounts for about 90% of the arm's function, not only is their language offensive, but it's also incorrect. So by using something like these guides to objectively put a number to their level of disability, it really helps combat that language. So pretty much how it works, if you look here at this isolated digit, a little over half of it is going to be impaired. And from the guide's algorithms, that's going to translate to about a 5% whole person impairment. Taking their whole presentation into account, that 5% jumps to 17% whole person impairment. Just to give you another frame of reference on that, according to the same guides, losing an eyeball, so your vision, your depth perception, that accounts for 16% of whole person impairment. So just these digits, not even totally lost, is essentially the same as losing an eye. So here are just a few more common examples of different presentations of digit loss that impairs the whole person a bit more than you might have initially anticipated. The middle picture here is unfortunately a fairly common presentation, lots of table saw and bandsaw accidents and crush injuries as well. And this is going to be congruent in impact with a below knee amputation, which usually ranges in the 28 to 32% range. So just 4 digits on one hand being affected and not even totally lost is essentially the same as losing half of a leg. So this is all to say that this is an extremely prevalent yet wildly underserved population that deserves more attention and resources from the medical community. And while there's this huge opportunity on the O&P side to reach this large untapped market, most importantly, it's an opportunity to help a population that hasn't been given the tools that they need to regain their sense of function and autonomy. So that's not to say that there haven't been options out on the market already, but there has been this fairly large gap between the needs of this hardworking population and what the devices can currently provide. So the most well-known option out there is going to be your passive restoration or your silicone restoration. While these absolutely do have a time and place for increased psychological positive impact, literature has shown in about a 1 to 3 year span, these people go through what's called a finger mourning loss process, and they don't really need this type of cover up anymore, and they really are looking for something a bit more functional. So long-term adoption for these options is fairly low. Which leads to the next option out there being myoelectric. From a functionality standpoint, these are way more functional than the passive restoration. That being said, recall what the vast majority of this patient population is. It's going to be healthy working age men, and they really need durable and robust prosthetics to, when they work in the water, oil, dust, and dirt. Myoelectric is very susceptible to those elements, and the training times on these can be pretty long and arduous. So the adoption rate for these are fairly low as well. And then, of course, I'd be remiss if I didn't mention that no intervention is by far the most popular type out there. And this is because there is that lack of awareness. And like I mentioned earlier, lots of these patients don't get referred into prosthetic care at all. So the vast majority of this type of patient population just learns to adapt to their amputation and don't have any prosthetics. And then, of course, the wheelhouse that we do fall into is going to be the body-driven. And while we are not the only body-driven options on the market, I do just want to take a little bit of time and explain what makes us a little bit different than what else is out there in the industry. So like I mentioned, when talking specifically about naked prosthetics, it's important to know what sets these devices apart from the other upper extremity options currently out there. Because each digit is custom fabricated for each device user's unique anatomy, we're able to optimize the mechanics of each device for maximum force output and optimum range of motion. So this is going to allow the devices to be incredibly strong in the ranges where most people's activities of daily living do occur. So to dive into that concept a little further, through years of research and development, we've discovered that most ADLs are going to occur within the ranges of a wide C grasp to as narrow as holding a hammer handle. And they're intentionally designed to be the most powerful within that space and not to extend past that range. So in other words, there's really no need to hold a tight fist or a full flat palm for the vast majority of daily tasks. And if we did increase the range of motion to accommodate those grasps, then the strength of the devices would suffer. And we really want these to be as strong as they possibly can in the ranges where the vast majority of someone's ADLs in that range is going to occur. Also, because our devices are driven off of intact joints and mimic natural hand motion, they're going to be extremely intuitive to use. This device user here was able to understand almost immediately how to use their demo device and no longer had to overcompensate his arm and shoulder to use the fork. So you can see his clinical presentation in that picture on the bottom left. And as you can see, in the left video, he's struggling to comfortably hold his fork, how to operate it properly. And when he does finally mimic what it takes to feed himself, you can see that he is overextending that arm and shoulder. This is something he's had to do because he's just had to adapt to his amputation, and this can cause overcompensation injuries, early onset arthritis, and a lot of other negative physical repercussions. So even just here with his sample MCP driver, you can see how much easier he can manipulate his fork, and he no longer has to overextend his shoulder and elbow to do that. And then additionally here, you can just see this user compare his end result custom 2-piece MCP driver device to the demo in the old video. And it's just really easy to see how much easier he can manipulate his fork in comparison. Also on the aspect of predictable grasp, we often get asked how much users can get this real-time feedback of how much pressure that they're putting into their devices. And we think we get this question a lot because of people's knowledge of myoelectric devices. And just to reiterate, because these are run off of a person's intact joints, they're able to, in real time, understand exactly how much force and pressure that their device is outputting. So just a really good testament here of him gingerly pulling off some grapes with his thumb driver, just to showcase how easily he can perform that task without crushing them. And then talking about predictable grasp, there's a few things in this video that I do want to mention. First and foremost, even though men are the majority of the patient base affected by digit loss, that's not to say that women, of course, aren't also affected. So this is Jasmine, and one of the first things she wanted to do since putting her demo devices on was to run her fingers through her hair and put up her hair without any assistance. And that's something that she hasn't been able to do independently since her amputations. So she was curious, with these devices being made of, stainless steel and silicone, how much hair might get taken out from this, fine motor skill. And she was very pleasantly surprised to see that just one hair was pulled. Something else really important to note with this video is this is her first time wearing these demo devices. They're poorly fit, not even curated for her specific anatomy. Had them on for about less than 5 minutes, and she's able to perform this really fine motor task without looking at the devices. So because she has a good idea of the length of the devices and the space of where the devices are in relationship to her hand, she's able to perform this task without looking at it. And this is her first attempt at it. So just a really good example of her showcasing that aspect. So just to touch base on our body-driven lineup, like I said earlier, we are in our second generation of these devices, and they are going to be 100% custom fabricated for each device user's unique anatomy. So starting starting distal and working proximally, we have our PIP driver, our MCP driver, and then our thumb driver as well. So starting off with the PIP driver, to be successful with this device, a patient will need an intact PIP joint and then enough residuum on that P2 to maintain purchase on that exoskeletal ring. The force output on these is going to be a direct 1-to-1 ratio. So essentially, however much strength and force that intact joint can produce is also what the artificial tip can produce as well. It's also important to note that, especially with this type of amputation, a lot of patients do suffer from hypersensitivity, and devices like the PIP driver do provide a lot of residual protection as well. And then, of course, kind of like what I mentioned before, they are designed in mind for this hardworking population. So they're dirt, heat, chemical resistant. And even though they are lightweight and almost simple in design, they're extremely strong and resilient and are aggressively life cycle tested and engineered well above the strength of what a human hand can produce. So even though they are lightweight and super intuitive to use, they're extremely durable and mighty and have a service life on average of about 3 years. So just talking and introducing the concept of patient goals to you all. We'll talk about this a little later, but this is Sherry, and one of the things she wanted to get back to doing prior to her amputation was getting back to her old typing speed. And here she is typing at about 84 words per minute. So me with my full 10 intact fingers, I can't even touch that. So Sherry is absolutely on a roll. Going into our second device here is going to be the MCP driver. So this, to be successful with it, you're going to need that intact MCP joint and then enough residuum to make purchase on that ring. Force output on these is just going to be a little less than what the PIP driver was. It's about 2/3 of the input. So for the average male, that's about 9 to 12 pounds. And that is absolutely ample strength to perform a lot of really robust ADLs. For frame of reference, holding a full bottle of water or a cup of coffee is about less than a pound per finger. So especially in the power hook grasp, these device users are able to accomplish and achieve a wide range of ADLs and pretty robust tasks with that type of force output. And then, of course, like the rest of the devices, they're aggressively life cycle tested, meant to be worn for multiple hours a day, essentially sun up to sundown, with a service life of about 3 years. A really cool aspect of the devices, and specifically the MCP driver, is talking about weight distribution. So this is Michael, and you can see his clinical presentation in that picture there. And as you can see, his only intact digits are going to be his thumb and his index finger. And this is his dominant hand. So for all of his ADLs on a daily basis, he is performing all of these tasks with just those 2 digits. And as you can imagine, feeling that force and tension and strain in that small space of his hand creates a lot of pain and a lot of negative repercussions. So this video here, he's essentially just a little taken aback by seeing his hand feel more complete than it has been since his amputation. And then this video here, he's holding a fairly heavy hand mold, and what he's describing is this instantaneous relief he's feeling from having his MCP drivers on to help redistribute that weight in a more even fashion. So his thumb and his index finger no longer are bearing the full brunt of the pressure of those devices. And sorry, let me get the mute. There we go. And so he's just really, really excited to feel that type of relief, which is something that we're really excited for our device users to experience. Here's another great example of someone really making the most of their devices, and this is Nick. A little bit more about him. He's an auto mechanic and a welder, and he actually runs a horse farm with his wife as well. Like many men, after his amputation, he was unable to return to his craft. At the time, the MCP driver was not yet on the market, and his prosthetist was transparent with him and letting Nick know that there wasn't currently a device out there that could keep up with his labor-intensive lifestyle. And he actually went about 2 years without a functional solution. When we finally did release the MCP driver, he and his CP worked together to make him one of the first device users, and now we refer to Nick as a super user. He essentially wears his devices from the moment he wakes up until he goes to bed, and he claims that it's a part of him. He even states that what he's most proud of, and this always blows my mind because you see him performing these really cool, robust, and also intricate tasks. But the thing he's most proud of is just being able to hold 2 objects at once again. Something that we take for granted and may seem like such a small task has become his biggest point of pride. So not only has he returned to his high intensity work doing what he loves, but he also feels like himself again. And then the last body-driven device here is going to be the thumb driver. It is going to look and function very similarly to the MCP driver, with just a few key differences. Along with tracking the MCP joint for increased functionality, the thumb driver is also going to track the CMC joint as well. And this is really good. Ideally, we used to think that the optimal candidate needed to have the functioning CMC joint, the intact MCP joint, and then a lot of residuum. And while that still is the case for more optimal functionality, we've actually seen a lot of device users get a lot of positive patient outcomes from just having a functioning CMC joint and just enough residuum to maintain purchase on that ring. Also with the thumb driver, there is a pre-flex tip on there. So even those with that lower sense of functionality, they can pre-flex that tip with a small coin or a flathead screwdriver and pre-flex it for whatever task that they're about to perform, just to optimize the device for its full use. And here's just a really good example of the devices being extremely intuitive upon first putting them on. This is a 15-year-old girl. She unfortunately had her thumb degloved from a horsing accident. And this is her day 1 fitting of her custom device. And the first thing she wanted to do was try to tie her shoes. Her prosthetist, along with everyone else in the room, said, you know, that's a pretty intricate task. I'd walk before we run. Don't get discouraged if it doesn't work out. And of course, being a teenager, she didn't listen to anybody, but she knocked it out on the first try. So I also wanted to introduce another device user. This is Matt, and he's actually our first device user to wear all 3 of NP's body-driven solutions. So as you can see, he's got his thumb driver there, a PIP driver on his ring finger, and then an MCP driver on his index. And as you can see through this video reel, that he can achieve a wide range of ADLs through the device's strength and dexterity. Before his amputation, Matt was a cement mason with the typical tough guy personality and took immense pride in providing for his family, and he actually just became a father to his new baby. After his amputation, Matt tried to return to work but suffered from too many overcompensation injuries and was left jobless and unable to care for his fiancée and 2-month-old newborn. He couldn't even hold his son. So unsurprisingly, he suffered severe anxiety from almost overnight becoming completely dependent and unemployed. He didn't know how to care for his family, which led to depression and a relapse in his opioid dependency. His CP enrolled him in the thumb driver beta study, and since receiving his devices in 2017, not only has he gotten clean, but he started his own cement masonry business and achieved his 2 patient goals of opening a jar of baby food and changing a diaper. And as you can see here, he also takes a lot of pride in performing these small tasks for himself that he normally wouldn't be able to do. Matt's actually also become an ambassador for us and is an admin in our support group, which I'll mention at the end. He essentially transformed from being closed off and unemployed to a business owner and a positive advocate for the digit loss community. And while Matt does have a happy ending, it's important to know how common the before portion of his story is with this patient population. Like I touched on earlier, The negative psychosocial repercussions of digit loss is extremely severe, and it impacts many people who were the breadwinners of their families or people who took pride in their sense of independence. And this type of amputation can leave them feeling extremely lost and in distress. But hopefully, with the help from all aspects of this patient's care team, which is therapy, surgery, and of course, you all with the OMP clinic, we can help assist in correcting these issues. So now I just wanted to brush through really quickly just a few of our design attributes. We want these devices to be extremely elegant in design. We know that your hands and your face are just two things that you can't cover from the world, you can't really hide, and they're the most expressive parts about you. You can't see me right now, but even going through this presentation, I'm using a lot of hand motions, and it's how people communicate and express themselves. And when people suffer from these types of amputations, they feel like there's this huge barrier between them and the public now. And we really want to switch that attitude from a point of shame and embarrassment to a point of pride. So we want these to be sleek and high-tech looking. And then, of course, like I said, extremely intuitive because these do run off of intact joints, very, very strong in the ranges where most people's ADLs occur. And they are going to be custom within millimeters of each device user's unique anatomy for that snug and intimate fit. So there was the rundown of our body-driven devices. And I want to take this time too to introduce our newest device, the grip lock finger. And what this is Naked Prosthetics' first metacarpal solution designed for those with MCP or more proximal disarticulations, resections, or certain comparable congenital presentations. And the grip lock finger here can be worn with any other NP device through the incorporation of a custom partial socket. So just to chat about this a little bit more, the grip lock finger excels at providing robust strength and force opposition by restoring power grasp as well as grip stability. Much like NP's other devices, by providing length restoration to the affected hand, it's going to allow users to regain the use of weight distribution among the digits, thus preventing unnatural metacarpal deviation and compensatory grip patterns. Through aggressive life cycle testing, we've refined the structure so that it weighs just 25 grams in its smallest size, but boasts a break strength of well over 200 pounds in the power hook grasp, which makes it an industry best for both strength and weight for a mechanical digit. So how it works, as you can see here, is that it uses a rack and pawl ratcheting system, and it consists of 11 unique locking position or clicks. It's designed to accommodate digits 2 through 5, and device wearers can position each finger using a surface or their other hand, and then they can return it to full extension either through the dorsal pawl or by moving the digit to the full flexion release point. So this video does a really good job at showing. You could see here as it goes down, they're going to click the dorsal pawls to release, and then they can also pull it as close to the palm as possible to also release it as well. And color-wise, they can match any other NP device, and they also do feature silicone pads for a better grip and protection against sensitive surfaces. And it's worth mentioning, if this new device piques your interest, then hang on to the end of the webinar and I'll explain an opportunity for some upcoming educational events to learn more about this through an in-depth clinical scope. So by this point in the webinar is usually when I get attendees inquiring about patients that they either currently have or ones that they've worked with in the past that could possibly benefit from a functional prosthetic solution, which is great, but now what? For me, arguably the most important step of getting a patient that you might have in mind fitted with an NP device will be assessing patient candidacy via goals and clinical presentation during the pre-evaluation process. So this step is going to be absolutely crucial in ensuring that the most positive outcome for all parties involved is achieved. So by getting your patient to list about 3 to 5 specific goals of what they would like to achieve through prosthetic intervention, patients begin to think about what they really want to get out of a device. For example, someone like Nick, who is aiming to get back to welding and farming, they might have different goals than someone who wants to get back to riding their motorcycle. Different tasks harbor different levels of difficulty. So the more the care team knows what specific goals a patient has, the better they can manage their expectations about realistic outcomes. And we actually recently came out with a pre-evaluation form that not only gives good instructions on how to properly take good pictures and videos of someone's clinical presentation, but also gives a space to write down those specific goals. And that's something I'd be more than happy to throw in the chat and send to you all afterwards to help you through this candidacy stage. So by being clear and transparent about what a prosthetic device can or cannot improve early in the process will directly be related to long-term device adoption. So when thinking of goals, while many people immediately start thinking about work-related tasks, like the tools pictured here in the top left, it's just as important to think of goals that would make them feel like they did prior to their digit loss as well. This could be small things like wanting to go out to eat with friends and being able to cut your own food, or to grab your baby's pacifier or feed them. It's also important to note that there are many device users out there who do not have optimal presentations that still achieve a positive patient outcome because they understood going in what the devices could provide given their condition, and those benefits were pretty aligned with their goals. So now that you have a good understanding of the pre-evaluation stage, I want to now walk you all through what to expect during an intake appointment. While we do have a great clinical team that can assist you through this, the intake process was designed to be as efficient and as simple as possible to empower you all as the treating clinicians. Now, I don't blame you for possibly seeing the intake as a daunting experience, especially if you don't regularly work in the upper limb space or have yet to fit an MP device. But I'm here to assure you that you've got all the knowledge and tools already to knock this out of the park. Because the devices are delivered as complete custom systems, we rely on strong and accurate intake by the clinician to ensure that the most accurate and best fit is achieved. So that being said, let's take a look at what's needed for top-notch intake. So before your appointment, you'll need to coordinate with our customer care team to ensure that you have all the materials sent to your clinic beforehand. This includes a demo of the device that's the most appropriate for your patient. This is something that our clinical team can help you determine during the pre-evaluation stage, along with the sizing rings. They'll also send you the intake form beforehand, along with quotes, reimbursement tools, and many other resources that make the appointment as easy as possible. You'll also need molding materials at the ready should your patient be an MCP or thumb candidate. So talking about the sizing rings real quick, as you can see here, they are specific to Naked Prosthetics. They come in oval and circle shapes because obviously with this type of patient amputation and the various presentations out there, fingers and residuums are not a uniform shape. So to get a more intimate and accurate fit, we wanted to create two different shapes here. And just to go through the intake really quick, the form really spells this out in a very intuitive way, but just to walk you guys through a couple examples here. Some things we'll need, especially in regards, as you see to the right, we're talking about the PIP driver. A base measurement, for example, you're looking here at number 1. It looks like we'll need a round on there. And just for the sake of this example, you can see that the base, the proximal base, will need a 12 round. And it's very, very important to note too that when you are filling out our intake form, that oval and round are different sizes. A 12 round is not the same as a 12 oval. So when you are filling this out, definitely make sure you're going through this with a fine-tooth comb to make this as accurate as possible. We'll also need the degree of flexion and extension here, and that's really simple. All you need to use is just a goniometer and measure that, and then just put that on the intake form as well. So those are just a couple examples there to help you best fit a PIP driver. And then another aspect of the PIP driver, you will also be selecting what type of tip. You have the organic, which is essentially an indentation mimicking what a fingertip looks like or a fingernail. And then there's also the minimalist. Keep in mind that the PIP driver is the only device that will have the organic option. So if you do have a patient that might be wearing a thumb driver, a grip lock finger, or an MCP driver too, they might want to stick with the minimalist just to keep the aesthetic consistent. And then with the MCP and the thumb driver as well, just going through these examples, here you see as an example at the proximal base that the sizing ring here. And it's also important to note, apologies if I didn't say it earlier, but what we're looking for when fitting these with our sizing rings, I call it the wedding ring test. It's supposed to be an intimate fit where if you shook your hand, the ring would stay on, but you could also easily take it off as well. So like I said, just a nice, snug, intimate fit is what we're asking. So for this example, on this middle finger, he is an 18 oval. And then you will also be selecting colors with your patient. I suggest going on our NP Devices website just so you can see the colors in their full glory and see the most up-to-date palette, because we actually did release our metallic line. We now have rose gold and midnight moss along with our other color options as well. So to make sure that your patients understand what options are out there, be sure to check the website. And then we also will be needing a positive mold for essentially any device that's not the PIP driver. So if you do have an MCP or a thumb candidate, like I said earlier, make sure that you have the materials for a positive mold. And just a few key factors of a successful hand mold that we will be looking for. We do need these 5 things to approve the hand mold. Keep in mind, like I said, your accurate and in-depth intake is directly related to how well we can design and manufacture the device. And we do use these positive hand molds as a reference for our back plates. So it's very, very important that we get a good, nice, relaxed hand, a lot of good detail here, a good neutral wrist, and we do need enough of that positive mold, about 1 inch or so beyond the wrist. And please do not send us the negative cast. We do need that positive mold. So although the intake form in itself is fairly straightforward, I really want to ensure that you all feel supported through the entire process, especially if it is your first couple of times working with an NP device. Our clinical staff and customer care team are happily available to assist in every step of the way, whether it's helping assess candidacy during the pre-evaluation stage, all the way to device delivery and beyond. Our clinical staff consists of a team of certified prosthetists and hand therapists that can hop on a Zoom call with you, help accompany those patient appointments. And it's really aimed just to make you feel as comfortable and as confident as possible through this process. They've even extended their customer care hours to be a bit more accessible for us on the East Coast. So please do not hesitate to take advantage of their help. All they need is about a 24 to 48 hour notice, and they're happily available to hop on a call and assist however they can. So with that being said, I do want to pivot from the intake and talk a little bit more about measurable patient outcomes and some of the tools that NP provides to help support you in your reimbursement efforts. So a great example here is going to be the interactive grasp pattern chart. We built this tool because we actually learned on average insurance claim adjusters only have 6 minutes to look through someone's case and assess if they're going to approve or deny them for prosthetic intervention. So we wanted to make something that was visual, simple, yet really, really effective. So how it works, as you can see here, the red circle indicates what grasp a patient can perform without their prosthesis. And then the blue circles that you'll fill out with your patient when you do get your demo device for that intake appointment, for example. These blue circles indicate what additional grasp patterns can be achieved through prosthetic intervention. So like I said, just a really nice visual way to showcase the medical necessity of these devices. It's also a really good tool in helping set and manage expectations. This patient, for example, as you can see, he cannot achieve all 16 grasp patterns, even with his NP devices. So this can be a really good tool to have that conversation about what the devices can or cannot provide early on. And then here, these are just simplified grasp patterns, often associated with myoelectric. So going through the same pattern here, you see without any prosthetics, no grasp patterns can be achieved. And then here in blue, luckily all 6 can be achieved. And so this tool is just, like I said, one example of the reimbursement tools, or the packet of proof, as we call it, that we help supply to you all to help combat that L7499 code. Just to go through a couple other resources that we do provide for you all, the letter of medical necessity is one of them. And essentially, this is just a really good, robust template that you're welcome to use as a jumping off point to help fill out for your patients. We also supply you the AMA guides that we talked about earlier in the presentation. Of course, the grasp pattern chart, which we just covered. And then we also have case studies as well. These just help with giving you additional measurable outcome measures for these patients. And we do have case studies for each of our devices on the market. So regardless of what your patient's presentation is, it's likely that we have a case study that has a similar clinical presentation. So all of these are just a few examples of ways we help support that reimbursement. And then, of course, a really big part that helps as well is going to be patient pictures and videos. And this is also a really good way for you all to help advocate for your patients too. Most of the videos and pictures that you've seen through this webinar were actually filmed for this intent. It's really effective for these insurance adjusters to see that stark before and after of someone struggling to do something without a prosthesis, and then immediately being able to tackle that task with just a demo device. It also helps when people bring in tools that they need to effectively get back to work safely, and showing that the devices are necessary to get them back doing their job. So all of these really help, like I said, help build that robust packet of proof to get these devices paid for. So to summarize, we know that this partial finger and hand population is large in number, yet is incredibly underserved prosthetically. And while NP only sells to O&P providers like you all, it takes the whole care team to connect and create those long-term positive outcomes that we've talked about. It really takes every medical professional related to this population to be equipped to have the conversation, the means, and the tools to support their patient through the process that's going to produce the most success. I often get the comment of, these devices are really great, they're very interesting, I'm very eager to fit them, but I just don't see this type of patient walking through my clinic doors. And this type of comment and this language stems from your local referral sources not being aware of what options and treatments are out there. And it's up to us, both as the manufacturer and the prosthetic provider, to correct this, both for your business and the patient's well-being. So as you begin to reach out to collaborate with these medical professionals that see this patient base most at the source, I hope you see this as an opportunity to be leaders in your field and provide this population with the novel technology that's now obtainable. And by being leaders in your field, you're bound to see growth within your clinic. And I want to explain just a couple reasons why clinical providers that are currently working well with us have seen growth within their clinics too. To start, this is a brand new vertical market. Like we discussed earlier, no prosthetic intervention is the most widely known type of intervention. So this is going to be a product that's aiming to capture an entirely new patient population for your business. You're not trading in this product for another one. There's really no direct competition. You're simply adding patients to your pipeline. Additionally, we do all of the manufacturing and designing of the devices, so the material cost and time on your end is going to be pretty minimal and very straightforward. And so all this to be said, we really just want to be here to support you. Every department is engineered to empower you. We're here to help fight the argument of, I don't do upper extremity or I don't feel comfortable fitting partial finger and hand patients. Regardless of your experience level in the partial hand space, we have virtual training available for any needs that you may have. Again, we really want to ensure that you have strong and successful patient outcomes here. And of course, along with the clinical staff and the customer care team, I do hope you see myself as your local education contact to assist with your business and your educational outreach efforts as well. Like I said earlier in the webinar, a huge chunk of my role is essentially raising awareness about prosthetic care through interactive and collaborative learning opportunities for the entire care team. On the day-to-day, I reach out to a variety of hand specialists in my area and determine their level of awareness about not only prosthetic solutions in general, but also finding out who their O&P contacts are, or if they even have any existing O&P relationships. Unsurprisingly to you all, oftentimes that answer is none. So this allows me to educate them and get them connected with well-versed O&P providers, just to ensure that they have a good relationship and all the resources that they need to be successful. I've been with NP for about 1.5 years now, and I've been part of the outreach efforts both in person pre-pandemic, but also in the virtual space. And I've been very pleasantly surprised by the wins and successes from working remotely. So this can be a really good time for us to work together to either execute some really interesting virtual collaborative events, but also lay the groundwork for when face-to-face meetings return. So that being said, just a couple examples. I facilitated co-hosted webinars with prosthetists to referral sources who are really, really hungry to help this patient base and get connected with experienced O&P contacts. Also doing individual outreach, talking co-branded marketing materials, and really we can get creative with how we can best work together. But just know that I am here as a resource to help you expand your brand, help educate you and your staff to be those device experts, and to get your local referral sources aware that you are in fact providing this partial hand solution to this patient base. So all in all, I do want to leave you with this. You are now educated on 4 different prosthetic solutions that cater to 94% of the entire upper limb population. And I hope you hear that and you're just as excited as I am for the potential of your clinic to grow by treating this underserved community. So of course you have both myself as your local education contact to help with this outreach, along with NP's customer and clinical team to ensure that the process goes as smoothly as possible. So I just want to close out this presentation here with just a few quick plugs. First and foremost, we do have an excellent Facebook support group for the partial finger and hand space. While NP did create it, we do not use it as a soliciting tool whatsoever, and our activity on the site is very intentionally minimal. We really let the partial finger and hand amputees run the space, and it just gives a platform for them to voice, their triumphs, their challenges, and just to connect with one another. So feel free with any patients you know to invite them to join. And it's also open for anyone related to this space. So prosthetist, hand therapist, anyone who works with this patient population, you all are more than welcome to join. And last but not least, we do have some great upcoming education. Like I said earlier, if you are interested about learning a bit more about our grip lock finger, we actually have some great remote sessions coming up, giving you a great opportunity to get a bit more of an in-depth clinical look at it. One of our clinical specialists, Chris Smith, will be the speaker, and I'd be more than happy to give you all those additional details and the registration links in the chat box. So that being said, that is the entire presentation. I thank you all so much for tuning in, and I'm very eager